and welcome to our weekly COVID-19 update. I'm joined today by our Medical Officer of Health, Dr. Lawrence Lowe, J.P. Maurice, our Manager of Bylaw Services, and Councillor Jeff Bowman, who will give an update on our bylaw efforts, but also the latest edition of the Brampton Farmers Market. I want to start off today by talking about vaccine progress. I have to say it is so encouraging to see record number after record number of individuals get their vaccines. Getting vaccinated paves the way to getting back to normal, and there's a real parallel with the success of the vaccinations and the reduction of pressure on our hospital system. We continue to see significant improvements in our hospital setting. As you know, Brampton Civic Hospital and Osler Health was the busiest hospital in the country when it came to COVID-19 pressure. They had more COVID-19 patients at one point than the COVID-19 hospital. And right now the picture looks very positive. 18 COVID patients at Brampton Civic Hospital, including 4 at ICU, one of the lowest numbers that we've seen in recent months. I'd also like to note and congratulate Dr. Lowe and his team for surpassing the 75% first dose coverage. You know, that was an ambitious target, and it's so encouraging to see that number achieved. I know when Dr. Lowe set that goal, there were some concerns. Would we run into vaccine hesitancy? Would we face systemic barriers? But with pop-ups, with mass vaccination centers, with the surgical approach that Peel Public Health has taken, we have surpassed our goal and continue to see success in getting vaccinations into arms. Now, I would note there's a lot of momentum, and that's very positive. We are keeping an eye on the Delta variant because that remains a concern, but I'm grateful that the province has announced a Delta variant hotspot strategy. I really believe that will help us contain those concerns around the Delta variant. As a reminder, in order to move to the next stage of reopening, we do have to have 70% of adults vaccinated in Ontario and 20% of adults must have their second vaccine. And I believe we're on target to hit those numbers, but just a reminder to everyone in Peel, by getting vaccinated, you help us reopen, you help us get back to normal. I also want to express my sincere gratitude to the team of frontline healthcare workers across Brampton, those in the hospital, the pharmacy, the public health clinics who continue to step up to vaccinate residents. It's a giant team approach, and we're seeing so many volunteers wanting to step up, wanting to help on that effort. I did want to speak to one issue that I believe could be amended when it comes to the reopening. I noticed last week York Region passed a motion calling for the reopening earlier when it came to the personal care services sector. And this Monday, the GTHA mayors put out a statement saying that we would be prepared if it was in advance of the July 2nd deadline for stage 2 reopening, given the fact that the COVID case picture has improved dramatically. Lockdowns across the province have led to an underground market when it comes to personal care services. And you have to call a spade a spade. Many people on TV, their hair is long and they look disheveled, but the reality is there's haircuts happening out there. It's in backyards, it's in garages. You've created an underground economy. And given the COVID case declines, I believe there is a pathway to safely reopen in advance of July 2nd. Personal care services had strict infection protocols and other safety procedures in place prior to the pandemic. These places have been closed in Brampton since November 23rd. As you may recall, the personal care services in Toronto and Peel were told on March 26th that they could reopen on April 12th, which did not happen due to the emergency brake being applied. As the number of COVID-19 cases continues to decline and residents get vaccinated, we need to reassure the personal care services that they will be allowed to reopen. And in my opinion, it could happen before July 2nd. And it's why I'll be sending a letter on behalf of this sector in Brampton to the Premier asking for that consideration of their date being moved up. Now, on the topic of reopening, I'm going to call up Councillor Jeff Bowman, who has some great news to share about the reopening of signature Brampton event that takes place this time of year, a sign that summer is here, the Brampton Farmers Market. And we've created an environment in which we can have a safe outdoor farmers market, and I'm so excited to attend this Saturday, and Councillor Bowman's going to tell you more about it.
Thank you very much, Mayor Brown. Good morning, everybody. I'm Jeff Bowman, Councillor for Wards 3 and 4, and as the Mayor mentioned, this Saturday marks the 35th consecutive year that we will be opening the Farmers Market, and that will run from 8 until 1 p.m. In downtown Brampton, and that runs till October the 23rd. It's a little bit different this year. Due to construction downtown in some of the areas, we've had to move the Farmers Market to a little different location. But rest assured, the Farmers Market is going to be there and better than ever. All your favorite artisans, the musicians, the food, the fresh vegetables, the fresh fruits, they're all going to be there. We've been working hard with the Region Appeal to ensure that all safety protocols will be upheld as well. So when you come down Saturday, please support these small businesses. They've really gone through a tough time and they need your support. So come on down Saturday from 8 till 1. Remember to wear your masks. All the vendors will be masked, all the shoppers will be masked, and social distancing rules will be in effect. So welcome back to the Farmers Market, a sign of great things to come this summer. I'd like also to speak about our bylaw, and we've had some great results. I have to say great results. The bylaw people have been, without question, overworked for many months, and they've done a fantastic job. So it's great to see that things are starting to move back into where they should be. Last week, between June 7th and 13th, there were 7 charges laid under the Reopening Ontario Act and only 1 face mask charge, which is absolutely fantastic. And it shows the amount of cooperation that we're experiencing in the community of Brampton. So I appreciate that. Let's remember that outdoor social gatherings are now at 10 people, and that includes members of different households if you so choose. Non-essential retail is permitted at 15% capacity. And again, if you've got a small local retailer that has been closed, it's now open to 15% capacity, please use them where you can. Maintain social distancing at all time and wear your masks. It's an important time for vaccinations, as the Mayor and Dr. Lowe will also talk about. A lot of people are getting their second vaccine, but we have asked you, if you haven't got those vaccines, still exercise caution. Wear your masks where required. Get out in the fresh air, get out and exercise, get out to your local parks. Have a great time this summer, but please be vigilant. And July 2nd can't come fast enough to those of us who've been waiting for haircuts. So I appreciate the fact that we're going to try and move those up. So thank you very much, and I will turn it back over to Mayor Brown.
Thank you, Councillor Bowman. On that note, it's my pleasure to introduce Dr. Lawrence Lowe, who continues to do a great job for us and the residents of Peel Region.
Good morning. Thank you, Mayor Brown, Councillor Bowman. This week, Brampton's test positivity is at 5%, with a weekly incidence rate of 46.5 cases per 100,000. Hospitalizations continue to resolve, thankfully, though the proportion of cases that are positive for the Delta variant continues to increase in our region. I know that many felt a certain optimism following the updated models that were released by the Ontario Science Table, which showed that a 4th wave resurgence in Ontario and Peel would be unlikely. But I urge everyone to read the fine print. There's always fine print. The model was very clear that in order to prevent a resurgence, we need to keep transmission low, and we need to continue to vaccinate steadily to 2 doses. This means that the continued reopening of Peel and Ontario is ultimately in all of our hands, and we should all have 2 simple goals. First, don't get COVID. Secondly, get vaccinated with 2 doses. We must all do our part. It's up to all of us. So how do you avoid getting COVID? Well, you continue to limit contact with people that you don't live in your home. It's okay to start reconnecting with others on a limited basis, outdoors, distanced and masked, but keep gatherings small, and keep circles close. Until we get to widespread 2-dose coverage, please avoid large crowds and packed in-person social calendars. Slowly opening to face-to-face activities will provide well-being benefits, but will also keep risk down as we race to get to 2 doses covered in our community. And that's our second goal, to get vaccinated with 2 doses. While we're currently at over 75% 18 plus first dose coverage, we are at 15% second dose coverage among the same population. And getting to 2 doses is the best way to stay ahead of the Delta variant and keep Peel and Ontario on track to reopen. I know that with the opening of expanded eligibility this Monday, some people may have tried earlier this week to get an appointment without success. Demand for the second dose is high, and for that I thank all of our residents. I know this may have been frustrating, but I urge you to try again. We have been rebuilding capacity that was reduced at the end of the hotspot strategy in May, and our capacity is dynamic and growing, with appointments being released throughout the week. Our shared goal continues to be to get second doses into arms as quickly as possible. And for some people, that may mean that the best choice you can make is to get a second dose of vaccine now that may be different than the one you got at first. For example, even if you got Pfizer, or as I did with Moderna, I know this may sound radical, but it's not. mRNA is mRNA. Pfizer and Moderna are both mRNA vaccines, and they essentially work in the same way. If you got one for your first dose, emerging evidence suggests that mixing them is safe and effective, so that you might be able to get either for your second. If you received AstraZeneca, you have 3 options: a second dose of AZ or either mRNA vaccine. But the point is, the best protection you can get with a second dose is the one you get soonest. The goal is to get 2 doses in any combination to keep yourself, your family, and our community safe. And also continue, as you do, to move gradually to reopen your social circles and stick to the distancing, masking, and the outdoors. Please don't meet up if you're sick. Get tested and self-isolate, even if you are partially vaccinated. If we want to see the no 4th wave model that the Science Table presented in their updated models last week, we must all get 2 doses while expanding our in-person contacts gradually with continued precautions. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe. And on that note, we're happy to take some questions. I see our first question is Graham Frisk from the Brampton Guardian.
Good morning, guys. How's it going? I guess my first question would be for Dr. Lowe. I just want to clarify, Dr. Lowe, you just mentioned there that it's safe to get a second mRNA dose after getting AstraZeneca for the first one. Now, is that true in the other direction as well? Is it or just for in that circumstance?
Thanks, Graham. The recommendation at this point in time is AstraZeneca. If you received AstraZeneca as a first dose, you can either get a second dose of AstraZeneca or you can get either mRNA vaccine, whatever may be available. As you know, AstraZeneca is typically being used, or at least used to complete series at this point in time, and we don't have large stocks of it to provide as second doses. The vast majority of second doses that are going to be delivered are going to be either Pfizer or Moderna, and the point of the message is that they are both mRNA vaccines. mRNA is mRNA. They are interchangeable to a large degree. Thanks for the question.
Okay, my second question for you, Dr. Lowe, again. Last summer, I mean, this sort of is following the pattern of last summer, where cases really dropped. There was no vaccine at that point. So I'm just curious, how much do you think the weather and sort of just the change in the season is playing into sort of this reduction? And how should people read that? Should they be not hesitant? I think that's the wrong word, but should how much, I guess, should they put into the stock of what the numbers are right now, just based on the vaccines?
Graham, so at the height of the first wave, we had about 500 cases. And so the decrease there in the summer was from 500 down to, double single digits. We came down from approximately a height in the province of Ontario of over 4,000 cases a day from the third wave. And that doesn't happen just because of the weather. I think both the measures throughout really saw the decrease and drove the decrease that we saw through May, kept our healthcare system intact with the ICUs filling up. And then I think the decrease that you're actually seeing now in June is some parts of the weather, but especially driving it all the way down now to almost below the first wave peak a lot of that is the vaccination and that first dose strategy that got out there through April and May. Thanks for the question.
Okay, our next question is Sabrina from the Mississauga News.
Hi there. So my two questions are for Dr. Lowe. So as the region is working to push out second rounds of vaccines, there are still some areas of Brampton and Mississauga, specifically the L4T postal code, that have a very low first dose vaccination rate. How is the region planning on addressing these communities?
Yeah, Sabrina, thanks for the question. We continue to run, our mobile outreach and community pop-up clinics in many of these neighborhoods. Particularly, just recently, we've also, with the launch of a youth strategy, been in schools, but have also been in places of worship, have been in community centers, and those postal codes will continue to be prioritized for broad efforts, both for first doses as well as second doses for such offerings, as well as community ambassadors who, I'm sure you've seen the reports, are going door to door in some of these communities, handing out flyers, helping people book, and getting them also to our fixed mass clinics. Thanks for the question.
Thanks. Okay, so my next question. So as you mentioned, when the second dose appointments were open on Monday and it was hard for people in Peel Region to get those appointments, are you recommending those in Peel who had the opportunity to get the second dose in other jurisdictions? Like there were some up north and there was, some in Scarborough open for people in Peel Region. Are you recommending residents to travel there for a second dose?
The province's booking system allows you to book into any jurisdiction, so certainly if that becomes an option for someone and they have the means and the wherewithal to do so, then, I encourage everyone to avail themselves of a second dose where they can. To be clear, that provincial booking system has also worked, somewhat not in our favor in Peel, where approximately 34% of our bookings at this point in time are non-Peel residents. So we're certainly hopeful that we'll be able to get additional allocation so that we can continue to open up appointments. And we have also written to the province asking for a way, especially given the focus on this area as a Delta area of concern, some opportunity to make sure that we're ring fencing a larger number of appointments for residents here in Peel. Thanks for the question.
Our next question is Nitin Chopra from Prime Asia TV.
Hello, good morning. My first question is to the Bylaw Director, or Mayor Brown can answer that. There are 50 locations of photo radar cameras in Brampton. There are total 10 wards. And what is the reason Ward 10 has only 2 cameras, Ward 6 has only 3 cameras, rest all wards have 6 or 7 or 5 cameras? Any particular reason for the distribution of these cameras? Thank you.
Well, I'll have JP Maurice speak to that, but I would say City Council's intention is to put the cameras in every community safety zone. So where there is a school or a community recreation center where there's children playing, where speeding is particularly dangerous, that's our priority. And so it takes time to install these cameras, but we did set an ambitious schedule and we're going to achieve it. And so I do believe in short order you'll see an abundance of cameras in those community safety zones in Ward 6 and in Wards 10 as well, and JP Maurice can add to that.
I could speak to, with regards to these cameras, it's mandated by the government to that they are placed in school zones primarily. So to place them anywhere else right now is not part of the government's mandate. So we're following what the provincial has outlined, and Bylaw is not directly responsible for it. Public Works looks after this particular facet of our enforcement. So any future cameras will be installed based on the province's guidelines and directions.
My follow-up is for Dr. Lowe or Mayor Brown. There is a woman who was being charged for not properly giving Brampton long-term care residents prescribed medicines. Any more details on that incident? Thank you.
So thanks, Nitin. Peel Public Health has not been involved in that investigation, and particularly as it concerns patient care, you would be best to direct that question directly to the home in question. Thanks for the question.
Okay, our next question is for Nikki Cedrone from the Bramptonist.
Good morning. My questions are for Dr. Lowe. When will those who are fully vaccinated be granted freedoms like not wearing masks?
Thanks for the question, Nikki. It's a great question. We actually wrote to the ministry just recently to request that there be, guidelines released in respect to fully vaccinated individuals. I do want to be very clear, though. We have to still be quite cautious because we have high first dose coverage, low second dose coverage, and we do have the Delta variant, which could be a game changer. So, certainly I understand the ministry is in a position where they are preparing that sort of guidance around precautions or not, or lack thereof for individuals who are fully masked and vaccinated. So I imagine they will release that on an appropriate timeline where the community second dose protection has gotten to a point and trends support it. Thanks for the question.
Thank you. Peel Region's appointments were filled by Monday morning, and supply at pharmacies appear to be drying up. Is Peel receiving equitable supplies, or is it demand for vaccines that are exceeding the supply?
It's demand for vaccines exceeding supply. Nikki, at this point in time, we estimate that approximately 620,000 residents are eligible for a second dose vaccination at this point in time, and we've received about 100,000 doses. So, certainly there's a recognition there that more doses are coming in. I understand that there is going to be a very large shipment of Moderna, for example, that will be coming in shortly. Of course, with our capacity, we are releasing more appointments as allocation and capacity allows. Thanks for the question.
Okay, and for our last question, we have Prabjot Sohal from Red FM.
Good morning. Thank you for taking my question. My question is for Dr. Lowe. Anecdotal evidence regarding Delta variant from India and some evidence from UK shows that kids are affected by this variant. Do you have any data about how many children in Brampton or the Peel region have been infected with the Delta variant?
Thanks, Prabjot. I don't have that number offhand, but certainly if you reach out to our communications associates, that we may be able to pull that. It's important to note that not all positive samples are tested for Delta, and also that the number of children who do still continue to get infected in our region remains one of the lower ends of the proportions. Most of our people that do get infected are between the ages of 20 and 59. It is also important to note that this is why we are trying to get to two-dose protection throughout the community, because the evidence from the UK is actually very clear that the vaccine helps to reduce severe illness, and it also helps to prevent infection when you get to two doses. Thanks for the question.
Thank you, Dr. Loeb. My second question is that last week you mentioned that there's low penetration of vaccine in the age group from 30 to 39. Has that picked up now in recent days?
No, Prabjot, that group continues to be a significant focus for our community. I would really encourage people, if you're 30 to 39 years old, we know that life is busy, we know that there are multiple competing demands, but you certainly want to make sure that you're protected so that you can continue to take care of your family, to take care of your aging parents, whoever might be in your life, and also ensure that they're protected as well. I know that for many people who are 30 to 39, it may be the first time they've gotten a needle in quite some time. So certainly if you're concerned, visit peelregion.ca/COVID-19 vaccine, and our clinic staff are always willing to certainly engage. There are private bays available. They're able to answer questions you might have. It's really vital that if we want to continue to assure our continued reopening, we need to make sure that we get to first dose coverage throughout and then on to second doses. Thanks so much for the question.
Well, that completes our COVID-19 update for this week. Please stay safe, stay healthy, get vaccinated, and until next week, thank you so much.